Welcome to PAMED Talks, a podcast brought to you by the Pennsylvania Medical Society. I'm Julie Heaney of the Foundation of the Pennsylvania Medical Society. Today, we're joined by Karen Allen of our Nurses Health Program Advisory Board, here to chat about recovery and the Nurses Health Program Participant Assistance Fund in preparation for the incoming National Nurses Day on Wednesday, May 6th. Welcome, Karen.
Thank you. Thanks for having me.
Can you tell us a little bit about yourself? You've had a meaningful career in nursing and now you serve on the NHP Advisory Committee. For listeners who don't know you, can you share a little about your professional journey?
Absolutely. So I became a registered nurse in 1985, which means I'm old. And I started at the bedside and took care of post neurosurgical patients and post cath patients. My dream was always to be in the operating room, and I finally got a chance to do that and became a staff nurse in the OR. And then I moved into the team leader for the open heart program at a level one trauma center, and I love that position. At that point, that's when I had an intervention done and started my recovery journey. And I said that I would never go back into management, which is kind of funny when you hear my story. Moved back to Pittsburgh at that point and started as the staff nurse in the operating room. And then about 8 months later, they asked if I would fill in for the supervisor who was going out on maternity leave. And so I did. And I stayed in that supervisor position for many years. Then they asked me if I would become the director of surgical services, which I did. About that time, we adopted our son and moved. So I moved to a different hospital as director of surgical services. At that hospital, I spent about 4 years in that position, and then the chief nursing officer asked if I would be the assistant chief nursing officer. And I didn't think I had the qualifications to do that, but she assured me that I would be successful, so I did. A few years after that, I became the vice president for critical care, surgical services, and ancillary services. And then when the CNO decided to retire, she asked if I would take her position, and the CEO agreed. So I became the chief nursing officer. And then many years after that, I decided that I would accept the role as president of two of the hospitals in our system. And then I retired, I guess about 10 months ago.
And you're enjoying retirement so far.
I highly recommend retirement. Yes.
What drew you to nursing in the first place?
Several things. So I first got my degree in education, and when I graduated, there were no jobs at all. And there were a lot of opportunities in nursing. So that was one factor that played into it. The other factor was my mother had cancer when I was growing up. And so I experienced nurses firsthand making a difference. And I really looked up to them and respected them and the work that they did. So that's what interested me, and eventually got me into the field of nursing.
Can you talk a little bit about your recovery journey and what that chapter of your life taught you?
Absolutely. So much. I was 29. And I didn't really know what I was doing. I think it's really important for people to understand that it's not like you set out to become, addicted, or, an alcoholic. That's not a goal of anybody. You just kind of end up there. And I was intervened on at work, and I thought it was the worst day of my life. And it ended up being the best day, because my life was impacted in every way, right? I became healthier spiritually, emotionally, physically. Um, I took on a whole new perspective on life because of my recovery. And I think every single person, could benefit from the principles and the philosophies of the recovery community.
What made it possible for you to accept help in that moment?
So, it had been a bit of a journey before that. And I remember a few weeks before the intervention, I, was praying to God for help because I wasn't quite sure how to stop. And so I believe that day, whenever I was intervened on, it was an answer, right, to that prayer. And I was ready to surrender and get the help that I needed.
And looking back on your journey with recovery, what do you wish more people understood about healthcare professionals who are struggling?
I think that it's really important to know that they're not bad people. Really great people. I know a lot of people in healthcare who are in recovery. Some of the best practitioners, some of the best nurses, some of the best employees that you'll ever find, right? It's a disease. It's not, a character. Um, malady. It's just really a disease. And we have to start looking at it that way in the healthcare profession. I wasn't one to tell people that I was in recovery throughout my career. There were a few select people that knew because I still felt so much judgment in the healthcare community. So I think that really stops people from coming forward because it is still looked at, it's a stigma. And I wish that we could do something to change that.
How did your recovery shape the way you showed up as a nurse after?
Probably every way. I think first of all, I showed up. My attendance got to be an issue at the end of my journey, in before I was in recovery. I think second of all, the principles of recovery like play so well in life. So, honesty, open-mindedness, willingness to do whatever, I needed to do. My outside life was really focused on helping others. And so I could leave work at work and then go focus on, people that needed help, which was really helpful. Um, I think I also was able to have more compassion for people who were struggling out there in the employee world. I could kind of relate to them and, I could take people under my wing. If I knew that they were in recovery, I could have conversations with them. I was a better nurse and overall just a better person.
Did it change the way you related to patients?
So I was in the operating room whenever I came into recovery. So most of my patients were asleep. So I don't think I had as much difference with the patients. Now, I will say when I got into administration, we had a drug and alcohol unit in our hospital. And I really supported that drug and alcohol unit from an administrative standpoint. I think some of the people on that unit figured out, she's very interested in, our program that I was in recovery. But yeah, just the support from an administrative standpoint for that program.
So, in connection with the NHP, what led you to get involved with the Nurses Health Program after your retirement?
So I knew one of the other women who was on the supervisory advisory board, and she actually happened to be the woman who led the group when I was in the NHP. So, in the NHP, you have to go to this group of other nurses and pharmacists and people who are in recovery once a week. And she led that group. And I just looked up to her so much. And over the years, we've gotten to know each other in recovery. And she knew that I had retired and she reached out to me and said, "Hey, would you be interested in, serving on this committee?" And, I have more time now, so I am interested in, what can I do to make a difference and help?
How does your personal experience inform the perspective that you bring to the committee?
So my personal experience, I was in rehab and they helped me get connected because I was in Tennessee and moving back to Pennsylvania. and they helped me get connected with the program. When I came back, and had to go back to work, I had to tell my employer that I was an impaired professional, which was a little daunting. But, that group of people helped me. How do you approach that? How do you, like, it was a support group. I think at first I thought it was going to be this monitoring program that was out to get me. And I found just the opposite. Like, that's where I could go for resources. They did hold me accountable. I used to complain that I had to get my slip signed for 3 years at meetings. And, when I look back on that, maybe that's exactly what I needed. I was very, motivated to get sober. I really was. So I had that internal drive, but just having that little bit of external, accountability. I know it's helped some of the people that I've sponsored over the years. And yeah, it's a little embarrassing when you have to go to your, interview and tell people that you're in recovery. And I was lucky enough to have somebody who gave me a chance. And then they had to fill out forms and send it into the Pennsylvania, program. And I was relieved when it was over after 3 years, but I had a great foundation by that point.
Do you think that accountability is what makes the NHP's approach so effective?
Absolutely. I think it's accountability, and I also think it's support and resources for people to know how to maneuver through this new phase of their life.
I agree. It's tough. I agree.
Yeah, yeah.
Yeah. Speaking a little bit more about the Participant Assistance Fund. So, the Nurses Health Program Participant Assistance Fund helps remove barriers to treatment and recovery for nursing professionals, especially with toxicology testing, which can be a daunting expense. Why do you believe that this kind of support is so critical?
So when you're in early recovery, at least for me, I was dead broke, and I had a lot of debt. And then on top of that, required to be in this program and having to pay for drug testing, having to pay for, which, I mean, I deserve that. I'm not saying that was a bad thing, and I'm accountable to that, but it would have taken a lot off of my plate, a lot of stress, financially off of my plate if I didn't have all of that burden as well. So I was digging my way out of, a lot of financial pressures and issues that I had created in my life. And then I also had to pay for the groups and for the drug testing, et cetera. So, and I was fortunate I was a registered nurse and was making okay money. There's a lot of people in this program that, have other jobs that they don't have that money, but they want to be compliant with the program, but because they don't have the money, maybe they can't stay in the program, and that affects their entire life. So I think as long as we are vetting the candidates and their financial needs, that we should all be supporting this. We need healthcare workers. Every hospital, every doctor's office is looking for help. And so if we support people at this time of need and they become productive members of our society and can work in healthcare and make a difference, like what a great way to spend our money.
It's a really good perspective. From your perspective, what's at stake when a healthcare professional does not get the help that they need?
Patient safety is number one. And we always have to put patient safety first. And number two is that individual's life. The individual, I've seen people die, from this disease. And I've seen people's lives just be horrific and ruined. And then on the other hand, you look at somebody as fortunate and blessed as me who took the help at 29, and my life is amazing today, right? Like I have 36 years in this recovery process. I have more than I could ever have dreamed of, and I wouldn't have any of it if I wasn't in recovery.
In that vein, what gives you hope when you think about the future of professional healthcare and recovery in healthcare?
I think more of us, need to admit that we're in recovery because I think that we need to change the perspective of who these people are. Like, I was always afraid, to say it because I was afraid of judgment. But I think we need to start getting taking that stigma away so more people will come forward. I'm going to put it out there. If anybody's out there struggling, call me, you know, email me, it's a great life.
My last question you pretty much covered, but is there anything else you would like to say to someone who's struggling silently right now as a healthcare professional?
I would say it's a lot better on the other side. There's really no joy or happiness before recovery when you're in this situation. It's just survival mode, and you can have a whole new way of life. So please put that fear aside and come forward. There's so many of us that are here to help you.
Thank you for sharing that. I'm sure that's very reassuring and it's a powerful thing to share. Is there anything else you'd like to share today?
Mm, I don't think so. Happy Nurses Week.
Happy Nurses Week. All right. Thank you for coming on, Karen.
Okay, Julie.
And if you'd like to find out more or donate to the Nurses Health Program Participant Assistance Fund, please visit foundationpamp.org/NHP to donate, especially in honor of Nurses Day on May 7th.